And thank you for joining End of Life Conversations and Reflections. Today, my guest is Dr. Pippa Hawley. Dr. Pippa Hawley grew up in England and she lived in New Zealand for 5 years and then immigrated to Canada in 1990. She was the first palliative medicine subspecialist in BC and founded the current supportive and palliative care service at BC Cancer in 1997. Dr. Hawley is a clinical professor at UBC, as well as the head of the division of palliative care at UBC, the only medical school in BC. Through her career, she found that there is no way to answer all the questions patients have. So she co-wrote a book called The Lap of Honor Book with Gaby Iru, and this is a no-fear guide to living well with dying. And she recently became a grandmother, and just this week had some exciting news about obtaining her license from Health Canada to conduct a study on the use of cancer for cancer-related symptoms. So congratulations, Dr. Hawley, and thank you for being with me today.
Thanks, Sarah. That was a lovely introduction.
Yeah, so I worked with Dr. Hawley for a while, but I actually don't know the answers to some of the questions I'm going to ask you. So I'm really interested about asking you about your experience with death and dying. And I would like to start by asking you about your first experience with death.
Okay, yeah, so I actually had quite a traumatic experience with death when I was a teenager, in that I used to be a lifeguard. I was a canoe lifeguard in the south of England where I grew up. And one day we found a body washed up on the beach that had been in the water for a long time. And I remember realizing that he had probably committed suicide by walking into the sea, and feeling so sad that somebody would put themselves through such an awful way to go. As the life must have been so sad and awful to have wanted to go through that, because it was very undignified and unpleasant.
Wow.
But then after that, most of the experiences I had, fortunately, were with a professional reason. I haven't had too many experiences with death and dying in my private life, other than the loss of a child at 3 days old, which probably is not a good thing to talk about on the video. But my main interactions with death and dying then have been throughout my medical training, and I've witnessed a number of deaths, been present at many resuscitations, some of which were successful, many of which weren't.
Yeah, so in your book, you mentioned a little bit about that and what people told you about their experience after they died. Is there anything that stands out for you that you still think about today or still guides your practice, or what you tell patients today about death and dying?
Yeah, so specifically what I've heard from patients is actually immensely reassuring. That I've never had a patient who I've resuscitated or seen resuscitated that's come back and been in a situation that they're able to talk that says it was an awful thing. They all say, oh, it was lovely. I felt like my body was floating above my body, and all my pain and all my worries just faded away. And I just felt this overwhelming sense of love and light around me. And some people say that they see people like angels and deceased family members, people that they've loved and lost, coming to get them. And they didn't want to come back. They felt like they were being dragged back into the earthly plane, where they didn't want to go. And I was thinking, well, you know what? That's actually it's not a bad thing. I'm actually not frightened of it. I hope it doesn't come too soon, but I'm actually looking forward to it as the last big experience you can have.
Yeah, and that's really comforting, obviously, because these are direct patients you've cared for telling you, so they wouldn't.
These are real people.
They're real people. It's not something you read in a book.
Yeah.
So I just want to piggyback on that, and I'm just curious, so what do you think happens after we die?
Unfortunately, I don't believe in an afterlife in the physical sense, but I think that once our brains have finally finished doing all of their firing and our body cells give up the ghost,
Yeah.
which is a process. It doesn't happen immediately after you've stopped breathing and your heart stopped beating. It takes some time for that to actually happen. But I do believe that once that process actually finishes, that's the end of our existence as an organism. But I believe that our immortality lives on in the footprint that we leave amongst the people around us. So our legacy is our achievements and how people will remember us.
Yeah.
I think that gives me the sort of impetus to try to do as much as I can while I can, so that I do make a footprint on this very short period of time in history that I'm actually physically present for.
Well, having worked with you for many years, I know that you work endlessly to improve access to palliative care for people, and your footprint is going to be huge.
Thank you.
And you know, the care we provide now is your legacy and the work that you've done so far. You worked so hard to create that program and ensure people have access.
Mhm.
So I know our patients are really grateful, and I'm really grateful that you've done all this work. And I know that you continue to do that with the cannabis study, which is also going to be really interesting. Is that going to be the first study of its kind in Canada?
Yes, there have been quite a few studies of cannabis in a variety of different forms for some particular syndromes, but this is the first one which is looking at studying a non-inhaled product. So because medical cannabis users don't want to smoke it, they don't want to get high, they don't want to be inhaling stuff, they don't want the smell, they don't want to harm anybody around them with the secondhand smoke. They want to use extracts, and they want to use extracts that you can buy, where you get a degree of choice as to the actual contents, rather than buying a proprietary product where it's kind of like a mystery box and you either take it or you don't. They like to have the flexibility to be able to choose different products. So this study is the first one that's testing products that you can actually go out and buy. It's also going to be interesting because we're using a novel trial methodology, which is different to traditional cancer type clinical trials, and that everybody gets the active products. There is a placebo product as well, but there are 4 in total, only one of which is placebo, and everybody gets all 4. So from a patient's perspective, every patient who participates will benefit from participation in the study themselves, because they'll be generating information that then they can use for their own care afterwards. And then all of their individual experiences will be pooled into a larger number so that we can do statistical analysis. And then we'll be analyzing the group as a whole once the study is finished. But that's been quite a challenge to get that methodology accepted amongst
Yeah,
the traditional medical research community.
but it's
But we're
certainly,
there. We're nearly there.
yeah, and it's really going to change a lot of things for patients who don't want to be taking opioids and really want to be trying things like cannabis to see if it helps.
Yeah, I hope so. But it'll also be helpful, I think, and it'll give have actual proper data on whether it works or not, because there's a big placebo effect with medical cannabis because people have to pay for it and it comes with a lot of hype.
Yeah,
And actually, there are some people who don't do well with it. I've seen people harmed by using it in the wrong way, or using the wrong kind, or using it for the wrong reasons. And I think we do need to have a lot more research so that those that may benefit are given the opportunity to do so with
yeah,
clear guidance on doses. And that's at the moment we don't have any guidance on doses at all.
right.
And also those who really shouldn't try it because it's risky for them or it might make their health worse, then they should be advised that we have evidence that it's not good for them, so that they don't waste their time and money and potentially put themselves at risk. So it goes both ways. You know, I am an advocate for people having access, but I'm also a very strong advocate for people having all the information and not just what they read on the internet by people who have a secondary gain, like they stand to gain
Yeah,
money by selling stuff.
yeah,
There's a
that's
lot of
really
that out.
important. Absolutely.
Mhm.
So I have a couple more questions before we get to your book. I just wanted to know, do you have any like fears around your own death? Like when you think about your own death experience, like have you thought about it, and do you have any anxiety or fear around it?
Yeah, I mean, I'm not frightened of the dying part myself, but I worry about the people that I leave behind. I don't want them to be traumatized by it. So if I was in a situation where I had something that was scary, like a big tumor on my face or something that was bleeding or something like that, I
Yeah.
wouldn't want my family to be um, feeling guilty that they should be, should be able to care for me at home. Like I'd be quite happy to go into a palliative care unit or a hospice,
Yeah.
so that they didn't have to witness that.
Yeah.
And I also have a little bit of a fear of being confused and accidentally saying something that might hurt someone's feelings that I
Yeah.
love without meaning to, because it's not really me speaking, it's the confusion.
Yeah.
So that is something I worry about. I wouldn't want to be confused.
Yeah. I think that's also a fear I have where I don't want to be out of my mind.
Yeah.
I just want to be able to have some clarity to the end.
Yeah. I
Yeah.
don't mind if I lose a limb or I can't walk or all those things. Those are all fine. It's all about my ability to express my love for my family, really.
Yeah. Wow. Thank you so much for sharing that. I didn't know the answers to any of these things, even though we work so closely together. And I just also want, I know you've been working really hard in creating guidelines around palliative care with the COVID pandemic. Like, what would you say is really important for us to keep in mind? And what have you learned about palliative care in relation to the pandemic?
Yeah, it's actually been very difficult for a lot of people. And the number of people that actually have died of COVID-19, certainly in BC, has been surprisingly small in comparison to other parts of the world. So we have got off extremely lightly in BC for very good reasons. Good leadership, and a really good public healthcare system, I think, has really got us out of what could have been a much worse scenario. But what has sometimes not been appreciated is that there was a big price to pay for that, and a lot of people are still paying it. And that as people were worrying about dying from COVID, there were a lot of other people who were living with serious illnesses like cancer or heart failure or strokes, all injuries, all these other things that are part and parcel of our daily lives, who some of them who died, and they didn't get the proper care that they should have done.
Yeah.
So I had many people that I've been trying to care for, who have not been able to access enough home care nursing because the nurses didn't have enough support. They didn't have enough personal protective equipment, at least at the beginning, though it has
Mhm.
improved a little bit now. They were the
Yeah.
last ones to get it. And a lot of people were frightened to go to hospital. So people were staying home when their families really couldn't provide the care that they needed. It was just not possible. And yet they suffered and struggled on at home, and some of them died sooner than they probably would have done otherwise because of fear of going to the hospitals and not being able to have visitors and not being able to be treated properly. So
Yeah.
it's had a big spin-off harm to other people dying of things other than COVID.
Yeah. Wow. I hope we can make plans for supporting people at the end of life, no matter what happens. If there's a second wave, I hope we're prepared. And I don't know if you're involved in any of that work, but I know you created some guidelines around that are available on the website, the UBC website.
Yeah, the UBC Palliative Care Division has a website, and one of the pages which we created at the beginning of the pandemic is resources around coronavirus, primarily for healthcare professionals, but there is some good information there for families and patients as well. Some of it is hopefully not going to be needed now, but it's still there just in case we do have a second wave.
That's good to know. Thank you so much for doing all that work. And now I want to,
Just so you know, I didn't do it on my own. There were plenty of other
yeah,
people who were involved. I have a good team.
yes. And then now we can get on to this amazing book that
Sure.
you wrote, The Lap of Honor, No Fear Guide to Living Well with Dying. So tell me how this came about and what's the purpose of this book?
Okay.
Um, yeah,
So when we're seeing patients, palliative care physicians, nurses, I'm sure it's the same. The amount of time that we get to be able to spend with patients is probably a tenth of what I would like to be able to spend.
yeah,
I feel like all of our interactions are kind of rushed. but we can't spend the time we want to because there's, you know, another 15 people waiting in the waiting room. And if we spend too much time with one person, then we can't see all the others. So you kind of have to be equitable. You have to distribute your available time reasonably fairly. So my frustration at not being able to share as much information as I would like, or interact as much as I would like with patients, came out with trying to create something like the book that will fill in all those gaps. So all the things we don't get a chance to talk about in person, I can at least say, well, you know, if you'd like to read about it, this is a resource that you can have a look through. And this may answer a lot of your questions. And it may even bring up things that you hadn't really thought of as being important, or things that you had as questions. But these really are things you should be thinking about.
Yeah. I love that you talk about like everything in here. It's like your insurance, travel, organ donation. You talk about hospice, palliative care. You talk about legacy. You know, there's so much. This book is so rich with information, but it's also really easy read.
Yeah, that was deliberate. We've tried to make it fairly big font, so that people who don't have great vision can still read it. That was important for me. Now I have to wear my glasses.
Yeah.
It has to be readable in bed in a dark light. But also, I think the joint effort that it was with myself and Gaby,
Yeah.
because we have complementary skills. It was better than just one of us alone. Either of us alone, I don't think, would have been able to have done the same as we managed by doing it together. So I think the bits that Gaby did really complement the bits that I did, and it's a very good joint effort. I'm quite proud of it.
Yeah, I absolutely love it because, you know, I work in palliative care and I found some information in there that was sort of helpful to me as well, just a reminder. And I love this idea of the legacy and the Record Me Now app where people can go and record their story or their message or what they want to leave for their loved ones. And that's also part of the book. So with this book, you get a lot more than just information. You get tips and you get resources.
Yeah, essentially we tried to take the trajectory of somebody right from the point of becoming unwell, just to having the first symptom, like maybe having a little bit of pain or a little bit of blood in the toilet or something like that. The first sign that something might be amiss, going to your doctor, talking to your doctor, going all the way through getting diagnosed, understanding the terminology that's involved with being unwell, and then trying to make the absolute best of it all the way through the course of the illness, including planning for if you don't survive, because many people have serious chronic illnesses and they get better. You know, they get plants or they get the new latest immune therapy or something like that. There's a whole variety of new things that people can have now where survival is still definitely a possibility. And palliative care is still very appropriate for those people. It's more modern palliative care where we focus on living as well as possible for as long as possible.
Yeah.
And it's not a choice between either palliative care or disease management. People can have both at the same time now. And I think that this, as far as I'm aware, is the first book that really focuses on that great unknown, you know, that uncertainty and living with the possibility you might die on a daily basis, but also the possibility that you won't.
Yeah.
Life goes on, you know, and stuff happens.
Yeah, but all the work you can do will eventually come
I guess nobody's getting out of here alive in the end. Yeah, true.
Yeah, and you can never do it too early, I guess. Yeah, so I love that this is about when death is, you know, one of your quotes in there was, when death is anticipated, care can be focused on creating comfort and peace. So I feel like when we talk more about death and when it is in the forefront, if we get more comfortable having those conversations, it really does improve the patient's experience and the family's experience. And talking about this, you know, topic is really helpful. And so I really appreciate you, you know, taking time out of your busy schedule to have this conversation with me. I also wanted to know where would someone find your book and how can they get their hands on it? It was
Well, it's stocked in a number of Vancouver bookshops, but Gaby and I self-published because we don't have a lot of resources for publicity. So if you're not in Vancouver, the best thing to do is either ask your local bookstore to order it for you, and they can order it from Amazon, or you can just order it yourself from Amazon.
Oh, it
And
is available on Amazon. Okay.
yeah, you just put Lap of Honor
Yeah.
in. There is another book called Lap of Honor, which is about a horse.
Oh,
So it's the one that's not about the horse.
okay. It's the blue one with the yellow that you want to.
Blue one, yeah. Lap of Honor, A No Fear Guide to Living Well with Dying. And Gaby Irew, Eirew, is the first author. We decided to go alphabetically, but we both contributed equally.
Okay.
And it's about $20. It's
A really good, like, yeah, you get your money's worth.
very
for sure.
reasonable. Yeah.
Yeah, absolutely. Yeah. So
We don't
anything
make
else
any money.
to add? Sorry?
We don't make much money from it, if anything.
No, it's super helpful though to have. I think everyone should have one of these books, you know, just to even on their coffee table. So thank you so much. And I cherish my book because it's signed by you.
That's lovely. Thank you.
And I will share with people I know. So thank you again. And have a good evening.
And you? Thank you. Enjoy the sunshine. The sun's moved around since I first sat down, and it's kind of in the, I'm trying to stay in the shadow now.
Yeah, it's nice that it's sunny after 7 p.m. Yeah.
It's lovely.
Thank you.
Okay, well, good night. And thanks so much, Sarah, for all the work you do on this. I think it's marvelous. You're doing a great job. Keep it up.
Thank you so much, Dr. Hawley.